Are you suffering from digestive problems, perhaps gas, bloating, irritable bowel syndrome, constipation, loose stools or diarrhea, maybe inflammatory bowel disease, acid reflux? Digestive problems are very common in Americans, and there's some reasons for that. The diet that we have, the food supply is contaminated, high stress levels that people have, medications that people take, and so a lot of people suffer from digestive problems. But in this video, I'm going to cover the gut essentials. These are some recommendations that you can follow, which I have found with patients, about 85% of people will get dramatic improvement in their digestive symptoms. Now, keep in mind, the digestive system affects the whole body. It totally makes sense because in the digestive system, especially in the small intestine, that's where we absorb nutrients. And so if you're not breaking food down well up higher, say when you're chewing it in the stomach and so forth, then you're not going to break the food down and absorb it properly. You're not getting the nutrition to the cells. Also, if you have bad digestion, then you're going to absorb toxins, metabolites that you shouldn't be, which will get into the bloodstream, cause an inflammatory reaction, cause basically a toxic effect on the body. So we don't want that to happen. So it's very important that we have a healthy digestive system. It's going to affect your cognitive function, your mood, your skin health. Studies show your heart health, your bone health, muscle and joint health. Essentially, every system in the body is affected by your gut health. But now let's get into the essentials of gut health, the gut health essentials, which will really help you with your digestion and your whole body health. Number one, let's talk about the dietary adjustments that you must have. The number one factor in American diets, which is really bringing down gut health, is a lack of fiber. Now, fiber sounds boring, but essentially you need it in plant foods. And so there's two types of fiber. You have the soluble fiber, that's the fiber you don't absorb, which helps to carry waste products through the digestive system. And then you have the soluble fiber, and that's the type of fiber which helps to reduce cholesterol, helps to smooth out your blood sugar regulation. And so both are very important. So fiber adds bulk to your stools. It helps you to pass food more smoothly through the digestive tract, like I said. And also fiber acts as a prebiotic. Certain types of fiber feed the good bacteria or the microbiome, which is so important. So some examples of high fiber foods. Well, in terms of fruits, you have high fiber in apples, pears, berries, and oranges. Now, of course, with the apples and pears, you should have the skin on them, so you're getting the fiber. Vegetables, many different vegetables. The ones which are very high in fiber would be broccoli, carrots, Brussels sprouts, leafy greens, all very high in fiber. Whole grains like oats, quinoa, brown rice, whole wheat products, unless you're gluten sensitive, legumes such as beans, lentils, and chickpeas. And then you have the nuts and seeds such as almonds, walnuts, chia seeds, and flax seeds. And so you want to get a variety of fiber in your diet throughout the week. Now, if you still struggle with this, yes, you can take fiber supplements. They're readily available. Get fiber supplements which don't have artificial sweeteners in them, which damage your microbiome and gut health. So you have things like psyllium, for example, and other types of fibers that you can safely take. Now, probiotics are essential to a healthy microbiome and digestive function. And of course, we get our probiotics in foods like yogurt with live cultures. You can get non-dairy yogurts, no problem. Kefir, sauerkraut, some of the Japanese traditional foods such as kimchi, miso, and tempeh. And so you want to get these foods which have the probiotics in your diet every day if you can, because we have to have that healthy microbiome, those trillions of cells which are part of your immune system, help you digest food, help you make nutrients, help you to reduce inflammation. Also, we want the prebiotics. We talked a bit about that earlier with the fiber, but prebiotic foods which have been studied include garlic, onions, leeks, asparagus, bananas, and chicory root. So they help to feed the good bacteria in your gut. And most people are not getting enough of these foods. Next, you have to be well hydrated. Most of the people I see in practice are not drinking enough water. And so obviously that's going to lead to things like dehydration of the digestive tract, inability to make digestive juices, and it's going to lead to things like constipation. So we've got to improve water. Most people need 60 to 80 ounces of purified water a day. If you're exercising a lot or you're in heat a lot, you will need more than that. What about exercise and gut health? Exercise is very, very important for many different reasons. But exercise helps to balance out the nervous system, brings the stress hormones down, improves gut motility. And so all these things work for long-term digestive health. So whether you're walking, doing resistance training, or a mixture, which is best, you've got to have regular exercise for healthy gut function. Now, one of the factors that we have with most patients, and you see with most Americans, they do not take their time to relax during mealtime. They're not chewing their food thoroughly. Their nervous system is not relaxed. And so the digestive juices, the digestive organs aren't going to work properly. You're activating the part of your nervous system, if you're not relaxed, which is going to counteract digestion. It's like if you're exercising, for example, your body's not worried about digesting food. It's going to send blood and nerve impulses to the muscles in the brain. Well, the same thing when we're eating. We've got to eat in a relaxed atmosphere, or as best as we can, slow down, chew your food, and A lot of patients find this is such a simple technique, but makes a huge difference. I've had many patients over the years tell me when they take more time with their meals, when they relax, when they chew their food more thoroughly, their gas and their bloating, abdominal cramping greatly improves just with basic techniques such as that. Also, we need to avoid common gut irritants. Let me go over some of the foods and substances which can disrupt the gut health and cause digestive problems. Number one, processed foods. And as it's been in the news lately with the new administration, artificial colorings and additives, preservatives, unhealthy fats, the rancid seed oils we've got to avoid. They harm gut health. Number two, many of you are a fan of coffee. And coffee can be okay, and there's a lot of positive studies on coffee, but if you're sensitive to it or if you're consuming too much, that can lead to irritation of the digestive tract. Some people, it aggravates acid reflux, other people, gastritis. It does stimulate stomach acid release, so when you have coffee, it should be around meals. Number three, alcohol. More studies have come out showing how alcohol causes inflammation of the gut. It increases risk of certain cancers of the digestive tract, and so that can be problematic when consumed in excess. And then the artificial sweeteners. We have all these foods out there now. These soda drinks, these juices, these protein powders, which have artificial sweeteners in them. Chewing gum often has it as well. And now the studies are very clear. These artificial sweeteners actually damage your microbiome, the trillions of bacteria, which are helping with your digestive system. So you've got to avoid the artificial sweeteners. Adequate sleep is very important too. Studies have shown when you're not sleeping well or getting enough sleep, that will cause your digestion to not work well. So it's important to have a regular sleep schedule. Go to bed and wake up at the same time every day as best you can to reset your natural circadian rhythm. Also create a restful environment. So make sure your bedroom is cool, dark, and quiet. Use blackout curtains if you need to. Use earplugs or white noise machines if necessary. You need to have a restful environment for adequate sleep. Limit your screen time before bed, using your phones, your iPads, watching television, using your computers. That blue light is confusing the brain, thinking it's still daytime, and so that's going to also cause problems for your digestive system, because as the night comes and your melatonin is secreted, your digestive tract should be in rest mode essentially and regenerating. Our cells of the digestive system do regenerate, so that's important. And so again, have a relaxing bedtime routine. Be very consistent with your sleep cycles. Supplements. Some of the key supplements which work well for a high percentage of patients include things like digestive enzymes. Full spectrum digestive enzymes with meals, if you're having digestive problems or if you're eating out or traveling, can be very helpful. And they break down protein, fats, carbs. They break down lactose, gluten, sugars, fibers, all sorts of things. So there's very high quality enzymes that you can get. Probiotics. Probiotics are effective. Now we should try getting the probiotics in our diet first, through the probiotic foods I talked about. Eating prebiotic foods which feed the good bacteria. That should be the basis. But for people who are still struggling with their gut health, taking high quality probiotic supplements can be very effective. Now, one thing to look out with probiotic supplements is a lot of the ones on the market, usually the ones are kind of lower cost. They do not contain human studied strains. So use probiotics which have human studied strains so you can know what you should expect, and there's some research behind them. Also, the amino acid L-glutamine is great because this amino acid is a fuel source for the intestinal cells and helps with healthy cell turnover. So these are the essentials to good gut health. I recommend you implement them immediately, and there's a very high likelihood you'll notice improvement in your digestion. For more videos on digestive health, you can see them on my YouTube channel.